Welcome to the Twin Cities Business Show. Today we are going inside the depths of the American healthcare system. We are talking to Kobby Amoah, the CEO of River Health. Kobby moved his company to Minnesota and is building the healthcare solution for hourly workers after he saw a big gap in the market. We're going to go deep on what it takes to build a fast-moving software company that serves working-class people right here in Minnesota. Welcome to the Twin Cities Business Show. We are here today with Kobby Amoah, the CEO of River Health. Kobby, welcome to the show.
Thank you for having me.
Very excited for this conversation. So, River Health works in the healthcare space, and your specialty is working with hourly workers. Can you talk a little bit about exactly what it is you guys do?
Yeah, so River Health is essentially building the best health plan for hourly workers. So if you look at the market today, if you are a full-time employee at a company that hires 50 or more employees, your employer is required by law to offer you health insurance, right? And there are a ton of options for your employer to choose from. Blue Cross, United, Aetna, name them, or you can be self-funded. However, if you're an hourly worker and you work less than 30 hours a week, by law, your employer is not required to offer you health benefits, right? So your options are you're either on your spouse's health insurance, or if you're under 26, you can be on your parents' health insurance. Or if you make, maybe less than $30,000 a year, depending on where you live, you can qualify for Medicaid. However, most hourly workers make too much money to qualify for Medicaid, but not enough to be able to afford a really good health plan on the ACA exchanges. And that's where River Health comes in, right? We have an affordable health solution that your employer can offer to you as an hourly worker that you can enroll in. And it gives you access to unlimited virtual care, in-person primary care visits, prescriptions, therapy, lab testing, and a wide array of services. So that's what we do, and that's the segment we're focused on.
Really interesting. Yeah. So you were born in Ghana.
Correct.
Your mom worked in the health system.
Correct.
Broadly speaking.
Yep.
Was there a moment that you remember where you saw what she was doing and thought, that's something that I want to do, or is that something that came later on?
Yeah, I think like when you raise in a household where, your mom works in public health, your dad as a priest, there's a lot of like care delivery and, you spend a lot of time with people in that setting. So there's some commitment to building solutions that can actually help people. But my mom would take me along on like just different public health drives and different public health initiatives. I knew about like the vaccination schedule at like a very early age, right? So it just had this draw to healthcare in general. But I've always been fascinated by technology, like what's new, like building my own computers and all of that. So I just wanted to be able to use that interest in technology to also do something in healthcare. Yeah.
Super interesting. So, most founders come along and they see a problem and decide that they should fix it, which is a totally wild thing to do. And I'm very grateful that people like you are able to do it. When was the moment that you said, the hourly workers part of this seems to be so broken that I need to jump in and try to fix it?
Yeah, I think it's essentially so when I say we, myself, my co-founder, a couple of the individuals on my team, we've been in a position where we didn't have access to employer-sponsored benefits, right? So we had to buy our own health insurance, going on the exchanges, trying to understand what a deductible is, what a copay is, co-insurance, all the super complicated insurance terms, right? And we just felt like, hey, maybe we could build a solution that actually works for us, right? Or like a few of the friends that we know. We really did not understand how big this hourly worker issue is, right? Until we started spending time looking at the number of people who do not have access to comprehensive health insurance. And that's when we realized how big this issue is.
How big? How big is it?
Yeah. So if you look at the United States, you're essentially looking at about 75 million hourly workers, right, that are not eligible for employer-sponsored health insurance.
75 million.
75 million. Now, if you remove the individuals who are under 26 because they could qualify for health insurance under their parents, you're looking at about 55 million hourly workers across the United States. And this is an issue for the hourly workers, but it's also an issue for the employers, right? So we have a ton of employers who rely heavily on hourly workers. You can think of employers in food and beverage and retail, in hospitality and logistics. They want to be able to offer benefits to their hourly workers, but it's just too expensive. Like the math just doesn't make sense. The average hourly worker makes anywhere between $35,000 to $40,000 a year. the average cost to offer group health insurance plans with a traditional health insurance plan to an individual for 1 year is about $10,000, right?
Wow.
So if you hire someone and you're paying them $40,000 a year or $35,000 a year, you're just not going to be able to spend another $10,000 just to offer them health insurance,
Right.
right?
Or
So
you have
then,
to fire a bunch of people to get there.
exactly, have to
Yeah.
let a bunch of people go to be able to get there. And so employers are also really looking for new solutions that they can offer to the hourly workers so that they can improve retention, reduce mischief, keep the employees happy and keep them around longer. An interesting stat is if you look at the restaurant industry, turnover is around 130%, right?
Wow.
which is insane to think about. But that's an industry where most employers just can't afford to offer benefits, right? So how can River help them be able to offer benefits to that population? So that's where the interest came from.
Really interesting. So, let's just take a restaurant chain, and feel free to use a name or of somebody you work with or not. But
Mm-hmm.
take a restaurant chain. Tell me about how they arrive at a point where they say this is something we should offer. It gives us a competitive advantage. Why are people choosing this option?
Yeah, we work with a ton of restaurant chains, right? National chains, smaller groups. We have clients like, Cracker Barrel. We serve the employees across the country. We work with Raising Cane's. We work with Taco Bell, the Halal Guys. A lot of these national brands. And like I mentioned earlier, if you are a restaurant and you hire hourly employees, restaurants actually also operate on like really thin margins. So these are not like software businesses that have
Right.
like 70% gross margins, right? So if you're running a business where you have about 5% margins on a good year, and you look at how much you have to spend to offer healthcare, you just can't make it work. So your employees are always looking for a new job that will pay them more and also give them better benefits, right? So you're trying to compete with not just other restaurants in your industry, but with companies that can actually afford to offer benefits, right? Now, there are some companies that hire a ton of hourly workers that offers them great benefit. Right? So, like Amazon is an example, right? So, Amazon hires a ton of hourly workers. If you're an hourly worker at Amazon, you get health insurance, you get vision, you get dental, you get college tuition reimbursement. This is not an ad for Amazon. um, but if you're that local restaurant or if you're a franchise, you just don't have Amazon's balance sheet, right? To be
Right.
able to afford to do that. So what solutions are available to you? And these are the employers that we're typically working with.
Really interesting. Really interesting. Um, Health insurance and healthcare in this country is really expensive and really complicated. Why?
Yeah. Um, yeah. That's the $4 trillion question, right? Today, right? Why is it super complicated? I think one, it definitely starts with an understanding of what health insurance is, right? I think we usually conflate care delivery with insurance, right? If you really think about insurance should be available to you. You should buy insurance just to protect you from risk that you're not aware of, right? You buy, homeowners insurance or you have car insurance in case you're in a collision. Um, with health insurance, we expect our health insurance provider to pay for our everyday healthcare needs. So if I go to urgent care or, if I have an upper respiratory infection, I'm using my insurance card, my insurance company is paying for that. And that same insurance company is going to cover your emergency room visit or, if you need surgery or if you're starting a family, right? It's just like a lot of different healthcare services that we put in one bucket and we try to insure that whole pool. And that makes it super complicated, right? So the system itself just doesn't make sense when you think about the things that health insurance covers. The other piece is just the incentive structure, right? That's built in there. I think, health insurance companies, you know, just draw a lot of attention because they're usually the ones denying the claims, right? And that's what people see. But then the whole system needs reform, right? There's a reason why you can't call your local hospital and ask them what it will cost to do, an X-ray or an
Which
MRI,
would be
right?
really nice.
It would be really
Yeah.
nice to know,
Yeah.
right? They actually can tell you, what these services cost, right? And it's also why, you can call an imaging center and ask for the price of an X-ray, and you can call another one 5 miles away, and like the prices are totally different, right? The system is very convoluted, and our approach is they're just setting services that are very predictable, right? So whether it's reproductive health services, or someone has a UTI, or they have an upper respiratory infection, or they need allergy medication, these are like very predictable services. We know how to deliver these services. we have a very good idea of how much these services should cost, right? If you show up to an urgent care with a code and they tell you it's going to be $3,000, you're going to walk away, right? Because you have a good idea of how much it should cost.
Right.
If I tell you, an MRI is going to cost $3,000, you're essentially not sure, right? Like, what type of MRI is it? What is it for? And so for these services that are predictable and we know what they should cost, we want to put them in a bundle and make it easy for members to buy that. And so we at River Health, we call that our essentials plan. Starts at $50 a month. It gives you access to everyday primary healthcare services, urgent care. You get everyday prescriptions, lab testing, and therapy. So if you need to go to urgent care, you're going in, you're getting that care. You're not paying anything out of pocket for that because that's included in that bundle. And then we underwrite catastrophic coverage differently, right? Because you're looking at a 28-year-old. What are the chances that they will need a hip replacement surgery or something of the sort, right? Very little. So like you can understand that risk pool and write that differently. And that's our model. And we think that model makes more sense than what we have today.
That's good. That's really good. Tell me, I want to go back a little bit back in time. And when you were young, you told me you moved from Ghana to England. Tell me a little bit about what that was like, and if there were any lessons from that you've been able to take to your life or your job today.
Yeah, I think in general, I think most immigrants who start businesses or who move to a new country, that's like it's a huge risk, right? You're moving somewhere different, you're meeting new people, you're making new friends. In certain cases, you're moving without your entire family. You're taking a lot of risk to be able to do that, but you also learn to adapt very quickly. And so when you start a business where especially in a highly regulated industry like health insurance, where things are changing every day, that ability to adapt and be resilient really comes to play there as well. And I talked about my parents earlier, and my parents moved around a lot for their work, right? And so just moving into a new community and meeting new people and establishing new relationships, you tend to learn a lot from that when you start a business, because there's also the part of the business where you're building the product and selling it, but a lot of business is also that relationship building, knowing how to talk to new partners, new employers, trying to understand what you're really trying to solve for and building the solution to solve for that. So that part of my life has really been useful now that I actually run a company here in Minneapolis.
That's great. So it's sort of adaptability, relationships being sort of at the core of
Right.
all of that.
Yeah.
How do so let's focus on sort of the adaptability and resilience. You talk a little bit about how that got ingrained in you in your childhood. How do you make sure that is a sword that you're able to sort of continue to sharpen over time?
Yeah. I think working in a startup will do that to you,
Yeah.
right? And you don't even have to make a concerted effort to do that. I think when you start a company, whether you're raising venture capital or you're self-funding the business, you usually go in with a thesis, so you have an idea of the problem you're trying to solve, right? And I think one of the great things about being an entrepreneur is you're very optimistic, and like every day you see there are like 1,000 reasons why what you want to do will not work, right? And so just being able to sit with that information and just not dismiss it, right? Just being able to sit with that and just keep asking why, right? Okay, we don't do things this way. Why is that? Well, it's because, I don't know, 15 years ago, someone decided we don't do it this way. No one has changed it since then, right? So being able to like go 3 layers deep to really understand why you can't do something and why that's a problem, and trying to like design around that. I'll give you a good example. When we launched our plan, everyone told us the way you launch a health plan is you rent a network of providers, right?
Okay.
And then you issue insurance cards to people, and then they show up to the clinic, they show the insurance card. The person at the front desk will put the insurance information into their revenue cycle management system. It goes to a clearinghouse. The clearinghouse will, adjudicate the claim. Insurance company pays. That's the system, right? Like, okay. But then when we looked at the math, when you're renting a network, it's very expensive, right? You could spend anywhere between $15 to $20 per person to rent a network, right? Not to even pay the providers, just to rent the network.
Jeez.
On top of that, the middleman, the clearinghouse, the administrators, they're all taking a cut, right?
That's why everything's so expensive.
Yeah, that's part of why it's
Yeah.
expensive, right? And so we're like, okay, this won't work for us if we're building, a really affordable health plan. So we're going to do something totally different. When you sign up for River Health, we'll actually issue you a River Health branded MasterCard, right? And then when you go to the hospital or when you go to the clinic, you swipe the card. The card infrastructure will check to see if that clinic is a clinic we partner with. or authorize it for the amount we have negotiated, and that provider gets paid on the spot, and
Mm.
you walk out. So we don't need to rent a network. We don't need to pay, a clearinghouse or a claims adjudicator. We can do all of that in real time using the fintech rails that we've built, right? And people say, well, that's not going to work. People are not going to know what to do when you give them a MasterCard. Turns out people can read and they know what to do, right? And it's actually worked out. And that's one of the components of our plan that I'm super proud of today. And we continue to do that in other aspects as well, right? Like virtual care. We decided very early on that we're going to build our own electronic medical record system in-house because
Wow.
it's too expensive to get Epic or Athena or any of these other systems. And in the beginning it was like super difficult because you're building all these features and that's not your core business. But now in the age of AI, that has been a real asset to us, right? Because we can look at the data in that EHR system and be able to get real insights from that. So yeah.
That's great. Um, so you identify a lot of things that are sort of classic high agency personality types about not accepting the world as it is and asking why on things that other
Hmm.
people just accept to be given facts. And you I think fit sort of many of the classical definitions of successful founders, right? It's just digging deeper on that and asking those questions. How did you go about building a team around that? Being self-aware of your own skills and knowing
Yeah.
here were the things that you needed, and just talk a little bit about how you built the leadership team you did and what those people all kind of do today to divide the work.
Yeah. They usually say that the team you build is a company you built, and that's actually like very true. It's like one of those truisms that you just hear is like too simple to be true, but it's actually really true.
And it was actually right. Yeah.
Yeah, right. So it's actually right. And the way River Health is structured today is, we have our growth pod. That's a team focused on growing the business, selling to employers, making sure employers are onboarded, the employees are enrolled in their plans. We have our clinical and member support team. That's the team focused on delivering healthcare services to our members, managing our network of providers, providing customer support to our members as well. We have our engineering team. Their job is really to support the growth and clinical parts to be able to deliver the services. And then we have like the operational component that does all the boring stuff just to make sure the company's
Mhm.
still running.
The boring
Um,
stuff that is essential to making everything else work.
exactly,
Yeah.
essential
Yeah.
to making everything work. Everything from actual internal operations to compliance to finance and everything. That sits in a different department as well. On the growth side, it's interesting because our growth leader, Shayla, doesn't have like a traditional healthcare background, and we actually felt like that's actually an asset to the team. Usually, when you start a health insurance company, you're looking for a sales leader who's sold a ton of health plans to large companies and understands how the healthcare system works. But when you bring in someone new who's willing to learn and understand how things work in that industry, what you quickly realize is they're good at asking why we do things this way, right? Like, why do we need to set up our benefits, explain it this way? Why do we have to talk to the brokers? Why do we have to talk to this employer, right? So it gets you to question how things are done and allows you to be able to move faster. So Shayla runs our growth team and does a great job over there. On the clinical side, we have our clinical group. So we actually employ the physicians who deliver virtual care on our platform
Hmm.
as well.
So
So
they work
yeah,
directly for you.
correct, exactly right. And we run a dedicated provider model. We really believe in that model. So when someone signs up for River Health, we ask for their location, health history. Based on that information, you're assigned to a dedicated virtual primary care provider. So every time you see your virtual provider, you can talk to them via text, video, text as many times as you want to. You're always talking to the same PCP, right? So
Interesting.
like they get to know you, they know your healthcare history. Maybe they saw you 3 months ago when you had a cold, and now you're showing up with a stomach bug or something of the sort. They have that there's that continuity of care,
You can
right?
just text with them whenever.
Yeah, you can text with them
Sounds
as well.
nice.
You can do video visits. You can do audio visits. Majority of our visits are text based, which is kind of a little surprising to me. When I say majority, I mean over like 98% of our visits are text based.
Wow.
I think a lot of people just want to text their provider, right? And maybe they don't want to do the whole video thing and get on a video call. And a lot of these visits are also during the workday, right? So they might be on the job, they're taking a lunch break or something. They want to be able to get their prescription refill in. They put in that visit, the provider reviews it. We partner with Amazon Pharmacy pharmacy for mail order delivery. So Amazon delivers the medication to their doorstep. They're able to access it when they get home. So that entire clinical infrastructure is run by Lexi. Lexi Leitner, who's our VP of Clinical Operations. So, when it comes to clinical, you definitely want someone who has a who has a clinical background
Probably does.
to run that for us. So, Lexi was previously at CVS and Optum and joined River, and then runs that team for us as well. Then we have our engineering team, and their job, like I mentioned early on, is to enable the product, enable the growth team and the clinical team deliver quality services and sell the products effectively. So they also do a great job over there. And then the operations umbrella usually falls under my chief of staff, Ryan, who gets things going on the operations side. So really great leadership team I have today, and we continue to grow our team and hiring for different roles. And we're in Minneapolis. We have a hybrid culture, so we have an office in downtown Minneapolis where employees can come in 7 days, and 7 days we're remote.
That's great. So, how did you end up moving your company to Minnesota?
Yeah, that's a great question. I get that a lot. I think I think maybe people don't understand how great Minneapolis is if you're running a health insurance company or a healthcare company in general, right? Obviously, there's like the United Health Group ecosystem here that they've built, and they're just great people who understand how health insurance work. They understand how care delivery works in general. But we went through the United Healthcare Innovation Program. It's this United Health program run by Matt Miller, who is the program manager. Supported by a couple of UHC executives that we got to interact with closely. John Cosgriff being one of them, and it was a great program, right? So we showed up. We had a lot of ideas on what we wanted to build, and the program was really great at helping us understand what it means to actually build a health insurance plan, build a care delivery business. How much capital do you need to actually do this, right? Because sometimes you just assume, oh, maybe you can pull this off for $100,000. Yeah, you probably can't, right? So just helping us really understand how this works. And just through that program was just supposed to be 3 or 4 months, but during that program, we met a ton of really great people who just really got what we're trying to do. So we're going to be here so that we can spend a lot of time with these individuals. Granted, maybe we have to drive out to Edina or Eden Prairie or something of the sort, or Minnetonka, but it's fine. We're city people, but we'll make the drive out. Just because of the people we met over here and what we felt like we could build, and a ton of health insurance startups in Minneapolis too, right? I mean, Surest is like one of the most popular companies. It's growing, but the other great companies in Nice Health, Gravy, just name them. Almost like once a month I'll hear of a company in the health insurance space that I've never heard of, and they're based in Minneapolis, right? So it's just a great ecosystem, and we decided to build a company here, and it's made it really easy for us to recruit and find great people.
That's great. That's really great. So, you went through that program in 2020, right?
Yeah.
Take me through just the entirety of your year in 2020 and how that transformed the way that you guys work, where you're located, and obviously everything happening in the world at the time.
Yeah, definitely a pandemic year. And
Me too.
yeah, right. Not the best year to move and build a business. But I think what the pandemic did is it really created like an intentional event around like healthcare and access to healthcare. And for all of a sudden, we're all talking about frontline workers, right? And frontline workers were, of course, like the nurses and the doctors and the healthcare providers delivering services. But frontline workers also included that server at your local restaurant, right? Who's risking their lives, put on a mask and show up and serve food, or deliver your food to you. And so employers really started to pay attention to that population and say, hey, the population out there delivering services, putting their lives at risk, that's usually like the lowest paid population right here. So what can we do for them? How can we deliver services for them? So it actually opened doors for us to have conversation with employeers and say, hey, we have a solution here that you could offer to that population, and it could really make a difference. And then, of course, there's the virtual care component, which just took off during the pandemic because, we couldn't go to a doctor's offices, so now everyone is doing is getting care through the app. So it was difficult to move and to build a company and to raise money, but at the same time, it created this environment where everyone's thinking about healthcare and care delivery and how to support frontline workers. So we're able to capitalize on that and have some of these important conversations with clients.
That's really interesting. So, your end users are these hourly workers,
Yeah.
right?
Yeah.
How do you make sure that, and they're people who are busy. They're working, they have shifts, they have
Yeah.
families, they have all these things.
Yeah.
They probably don't want to spend a ton of time interacting with their provider, right?
Right. Right.
How do you make sure that you're getting the right information from them? How do you make sure that you guys are tapped into the people that you're actually delivering services
Yeah.
to make sure you're getting all the right feedback on things that you need to improve about the product and the experience?
Yeah. So the end user, you're right, is definitely that hourly worker. But we're selling to the employer. So we
Right.
also pay attention to, the employer and what they need, right? So like on the employer's end, you want to give them flexibility around pricing, right? How much you want to contribute towards the plan. But you also want to make it easier for them to offer the plan from an administrative standpoint, right? So integrating into their payroll system, pulling a list of eligible employees, like the hourly workforce, people are in and out all the time. So, today employee A is employed and it's enrolled in a River Health plan. 3 months later, they're gone. A month later, they're back. How do you administer the benefits and get them into the pool as quickly as possible? And then for the employees, we've just spent a lot of time really trying to understand how um, hourly employees work, how they live, how they want to actually receive healthcare services. Initially, we spent a lot of time trying to understand how can we build a relationship between that hourly worker and a dedicated in-person primary care provider,
Mhm.
right? And just quickly realize that hourly workers usually don't know their schedules 2 weeks out, right? They're getting their
Right.
schedule for the next 2 weeks. So if they have to call their PCP and the PCP is like the earliest appointment, it's like 3 weeks out or 4 weeks out. It's like, well, I don't know if I'm going to be available at 2 p.m. on a Tuesday 4 weeks from now,
Right.
right? So we had to design our network to be urgent care, retail clinic heavy so that you can just walk in and get the care you need. That's an example of trying to understand the hourly workers and what's important to them. I talked about prescription delivery. That's an
Mhm.
important one as well. It might be very easy for most of us to just walk to our local pharmacy and pick up a prescription. For an hourly worker, if you're being paid by the hour and you're working late, and you get home, maybe the pharmacy is closed, but if we can deliver that medication to your doorstep, you have access to it as well right away. On a broader plan design level, our internal motto is what you see is what you get because we really want to simplify the benefits design. I work in healthcare and healthcare is still super complicated for me. And so, for an hourly worker who's not thinking about healthcare every day, if you put a plan in front of them that has, a copay, a deductible, co-insurance, out-of-pocket maximum, a narrow network, understanding what the PPO is, it's just not going to work, right? And so, otherwise, we just really want to make this simple. This is the plan of the cost of the plan. Everything else is $0. And if you look at our formulary, we don't have like a tier one, tier two, tier three medication formulary because if you look at a traditional health plan, if it's tier one, maybe it's $0. But if it's a tier two medication, then there's a $30 copay. And then if it's tier three, it's a $75 copay. So if you're an hourly worker and you're going to pick your medication, how do you know if my med is like a tier two or tier three
Right.
medication,
Right.
right? So I don't know if I'm going to pay anything out of pocket or not. And our benefit design is simple. Like if it's on our formulary, it's covered. If it's not covered, right? So you know what you're actually getting out of the service. So we've had to design our benefits differently from your traditional health plan just to serve that population.
Very interesting. So you guys are obviously building a company within the system as it exists today, right? If you could design your ideal system from scratch, do you
Yeah.
think tying health insurance to private employers is a system that makes sense?
Yeah, I think that's one where a lot of people say like it just doesn't make sense to offer health insurance through your employer. Um, Maybe, but just from like a risk standpoint, the employer group is like sort of like the only natural group where you can get a diverse group of individuals to underwrite, right?
Mm.
Other than that, you might use something like, okay, let's look at other natural groups, maybe your church or mosque or temple. Yeah, maybe, but you probably don't want to use that as well. You also definitely don't want to use like zip codes. It gets complicated. Your zip
Right.
code determines how healthy you are, right? So the employer environment is one of the few natural groups where you have people from different socioeconomic backgrounds, but you also have like different generations all mixed into, one risk pool, right?
Mhm.
So I think there's a benefit there. But to your point around if I had to design the whole system from scratch, I think the most important thing is actually how long you stay on your health plan, right? Which is a little counterintuitive, because if I run a health plan, I know that Charlie's going to be on my health plan for just 12 months, right?
Right.
There's no financial incentive to invest in your long-term health, right? So if I'm offering solutions now that I'm going to see the benefit of this like 3 years from now, right? 3 years from now, you're not going to be on my health plan, right? Maybe you're
Right.
going to be on some other health plan and you're going to get the benefit. So I spend a lot of my time thinking about my risk profile and my loss ratio, and I'm looking at it on a quarterly basis and the amount of risk that I'm getting. And our solution to that is to say, okay, if we can remove the risk from the calculation and we can focus on delivering care to you through essentials plan, then maybe we can take that long-term view. And then the catastrophic coverage piece is it's a little different. So yeah, my solution would be let people commit to health plans for like 5 years straight
Yeah.
and let the health plan take a long-term view of their health. And the conversation should be, how do we keep this person healthy? We can invest in more preventative healthcare services, more screenings, and that will reduce cost or actually reduce the rate of increase of healthcare cost 5 to 10 years from now.
That's a very interesting idea. Both of those are really interesting ideas. Both employers as proxies for interesting mixtures of the
Yeah,
population,
yeah,
as well as thinking about some of the long term care.
right. Yeah.
If there's an hourly worker out there who's listening to this and wants to take a step to improve their long term health outcomes,
Yeah.
what is the most immediate step that you would encourage them to take?
Yeah, I mean, I think one, get a good healthcare provider if you can, right? If this is one close to you, if you want a River Health plan, reach out to us through our website. We don't sell directly to individuals; we sell through employers, but we have broker partners who can sell directly to individuals. So we can put you in touch with a broker who can enroll you in one of our plans, and you can get access to a provider who can maybe start you off on just basic screening. I think what we see with a lot of the hourly workers we onboard into a platform is the utilization curve usually just goes like that, and then it starts to go down to a couple of months because most of them haven't had access to quality healthcare in a long time.
So right at the beginning, they use a lot of
They
services, they
use a
engage
lot of
with it, and then
service.
it just falls off over
Yeah,
time.
yeah, we'll kind of like normalize, right? And so if you haven't been to your doctor for your annual physical or your well woman exam in like 3 years, and now you have access to it at no cost to you, we want you to use that, and we actually see them use that as well, right? You're able to refill medications. You're not worried about how much those meds will cost. So if an hourly worker, yeah, the suggestion would be find a PCP. If you come to River Health, we can help you find one. And then start with some preventive care, some annual physicals, and get a baseline, and then you can work on that. You can work on it from there.
Really interesting.
Yeah,
I want to go back to the technology a little bit for a second.
yeah,
You mentioned how AI has really transformed some of the stuff that you guys have done, and having a company in 2020 that has such a heavy software presence is probably so
hmm
much different than doing it today. And
yeah,
so, can you talk a little bit about what AI has done to and done for your company? And we're living in the agentic AI
yeah.
world right now. Where do you see some of that going in the next few years? And are there any particular areas that excite you?
Yeah. So we can look at like what's true now, what we're doing now, and what's possible in the future. I think what's true now is there's just like a lot of cost savings from an administrative standpoint that you can get with AI today, right? Good example is customer service. So someone calling in, they have questions. A lot of like the customer service questions are very predictable. It's like, is my prescription covered? Is my medication covered? Where do I find my River Health card? Right? Where do I find my prescription card? These are like very predictable questions that you can have a good agent like answer and not just provide like a generic FAQ answer. It can actually
Hmm.
guide the member on how to access that information and even do things like explaining benefits, right? Because usually we just give you a PDF that explains everything that's included in your benefit, and maybe you look at it once and then you forget about it,
Hmm.
right?
Huge
And
file.
yeah, huge
Yeah. Right.
file, has all the disclosures in there that no one actually reads. And so with AI, you can just, get on our website, get in that app, chat with the agent and ask very specific questions, right? Like, Is the service covered? Is there copay for this? Is this medication covered? And it can just surface that information to you in real time. And that's very useful today from a customer service standpoint. The other piece of what's true today is just product development, right? You have your engineering team moving a lot faster today because every engineer is using Claude or Codex or whatever their preferred coding tool is. And so your product roadmap shifts from planning, 8 months, 6 months out to maybe planning on a weekly basis because you can just get features out very
That's
quickly.
how much your
Yeah.
timelines have shrunk.
Yeah, you just like can shrink very quickly.
Wow.
Yesterday I was actually on a call with a broker, and they were reviewing our solution in our broker portal, and there's just something that wasn't working. And yeah, we just had an agent fix it and push it live on the Zoom call, right? Kind of had it fixed right on the Zoom call. So
That's wild.
yeah, it's such an interesting time to be alive, and just like the savings you can get from that, with just how quickly your engineering teams move it. Like it doesn't mean we don't need engineers, but the engineers we have can do 3x more
Yeah.
than what they could do just like 2 years ago. On the clinical side today, some of the basic applications are just summarizing visit notes, right? So if you're a physician and you're seeing patients, you're talking to the patient, or you're going back and forth with them, or it's a video visit, then you have to document everything that happened, right? The interaction you had with the patient, because by law you're required to do that in the EMR. That's a use case where an agent can document that in the EHR for that provider, and they don't have to spend time manually doing that, which allows them to see more patients and deliver more care, or even spend more time with that patient. So that visit doesn't have to be 15 minutes or 10 minutes because I have to spend 7 minutes just documenting
Right.
whatever happened. You can do that. Looking into the future, where it gets really exciting is two areas. One is just understanding risk better, right? Today, when you're underwriting a population, you're kind of looking at things like, zip code, gender, age, these like traditional markers. But if you can really dive deeper into the data and get more demographic data about that population, you can be able to surface very interesting trends that can allow you to better price the insurance products that you're offering to that population. It also allows you to build what I call like micro plans within your bigger plan. So you might have a population. So let's say someone gets on your platform, they want to enroll in a health plan. The employer is offering it right now. They only have one option, right? But what if, maybe Sally is interested in weight loss? She's 55. She has, very different healthcare needs as compared to, Jane, who is 28, and maybe it's interested in being more athletic, or being more active. Just like very different health needs here. And can you design a plan that maybe in Sally's plan, GLP-1s, for example, are covered, right? But in Jane's plan, GLP-1s are not covered, but maybe she gets like a Planet Fitness membership or something of the sort. It's very different, right? You're not customizing the plans, maybe not at an individual level, but you can have subgroups within the entire population.
Do you think AI can really enable this sort of customization?
Oh, 100%, right?
Yeah.
It can enable that. The challenge with this customization is, whoever is doing the underwriting is just going to go crazy if they try to do this, right? Just from like a human standpoint, it's incredibly difficult to do that. But with AI, you can be able to do it. And then you can also analyze claims in real time, right? You just have to wait till, the end of the quarter or whatever to see how you're performing. You can see the data coming in real time. You can know who to follow up with, right? Because the AI can analyze all that data. We can look at the population and say, well, you went to this imaging center over here. Maybe if you went there, it would have been $500 cheaper. It could save you $100. You can do this in real time and be sending like alerts to that member in real time, and they know what you're doing. So that piece is exciting. And then on the care delivery side as well, I just like happen to believe that we really should enable providers to use as much AI as possible. And it seems scary, but today we're relying on people to really understand your full health history, right? And be able to provide the best care possible. I don't think AI replaces the provider, but AI can bring context that the provider otherwise would not have. It can, process everything from your wellness data, from, your Whoop or Aura Ring or whatever, understands where you live, can, bring in other social determinants of health, in addition to what you're dealing with, and be able to provide a recommendation to your provider, or tell the provider, hey, maybe ask Charlie these questions, right? Based on this information that I have. And it's really going to improve the quality of care. And I think it's going to improve outcomes as well. So really excited.
So the future is human doctors operating with massive amounts more data and ability to make recommendations based on that data.
100%, right? And I think that the doctors do not necessarily need to understand, how the AIs end up with that recommendation. It will definitely be some form of a black box here, but the AI providing the doctor with pointers and ideas on like what's important or what to mention during the conversation is going to be like super helpful. I'm aware of a pilot program where therapists actually have an AI listen to the conversation and can prompt the therapist to say, hey, you know, your client talked about this and you didn't, dig deeper into that. That might be interesting to spend some time on that, or, you missed this or you missed that. And that's very helpful. It makes the therapist better, right? And, from just like a financial standpoint as well, if you have better outcomes and you in a insurance arrangement where you get reimbursed based on outcomes, that's a different conversation. It could also be very profitable for that provider as well. So like usually you don't see a ton of like win-win situations in healthcare,
Mhm.
but the use of AI might just be one of those exceptions.
That's
Yeah,
great.
so definitely excited about that. Yeah,
Really cool.
yeah,
Um, where's River Health in 10 years? Do you want to grow and be independent? At some point, does it make sense for you guys to get acquired? I mean, give me a vision for some potential outcomes a decade from now.
yeah. So, like our vision is like really simple. We want to be the best health plan for hourly workers. That's it, right? At the end of the day, and so when you think about being the best health plan for hourly workers, you need a distribution, you need a talent, and you need a capital to be able to do that, right? And so what are the channels that gives you the best opportunity to get all three, right? And that's how we think about it. So we don't like necessarily angle for like an exit to say, hey, we want to be part of this bigger company.
Right.
The vision is we want to be the best health plan possible. And so if you need capital and you need to pull it from different sources, right, whether that's through an existing insurance partnership or through venture capital, then you're able to make that decision at the time, right? If you need distribution, whether that's through partnership again with an insurance company or working with brokers, you're able to make that decision at the time. But the North Star is always just to be the best health plan for hourly workers and to be the market leader in that space.
That's great. You mentioned earlier that you're not just going to be able to raise $100,000 and do it all. So, can
Yeah.
you talk a little bit about where your fundraising is at now,
Yeah.
and where you think it might need to go in the next 12 months or so?
Yeah. So when we started the company, we raised our seed round from a good number of like investors here in Minnesota as well. So Bread and Butter Ventures, one of the investors in the company. Matchstick Ventures is also another VC firm. So it's an investor in the company. When we raised that Series A round, we expanded the group of investors that we have. We have Six Ventures, who's a major investor. They're based out of the DC area. Northwestern Mutual as one of our major backers as well, and they've all been great investors for us. The way we think about capital today is there an opportunity that we otherwise wouldn't be able to get because we don't have the capital to execute on that, right? So if there's a group that's large enough that you need enough capital so that you can manage that risk pool, and then we're going to go raise that capital to be able to get that group, right? Or if we were distributing the product and we want to build, we need more providers, or there's certain markets that are not profitable yet for us, but we still want to invest in those markets because we think at scale they'll be profitable for us. Then we want to be able to go raise capital and do that. And when we're raising capital, we're also looking at not just investors who bring capital, that's important, but also investors who understand health insurance and understand the healthcare business and can focus on the metrics that actually really matter, and also share our goal in building the best health plan for hourly workers. And those are the type of investors that we're looking for. And so far, we've been lucky enough to partner with great investors who also share that vision for us.
That's great.
Yeah.
If you got to snap your fingers and trade places with another CEO for a month, what company would you like to run?
Oh, that's really interesting. Well, I go back and forth between SpaceX and Apple,
Okay.
and that's
You're aiming very small here.
yeah, no, right. That's a very stock answer, but I can tell you why. Apple, because honestly, I'm a fun boy. It's like buy everything Apple. I like have old iMacs in my collection because I like to collect them. So I like to be Apple CEO just to see what new products are coming.
Yep.
That's about it. And I think Apple is also very invested in like health and wellness. And if I could like force them to build more ambitious products and not just do like fitness trackers, but actually like have some skin in the game, do something more than that. That'll be interesting. And then SpaceX, because if like ideally I could put myself on my own rocket and see what it's like in space, I'll do it any day. I'm not sure why Elon has never been to space, but if I was CEO of SpaceX, I probably would be on a rocket myself.
Absolutely go to space.
Yeah.
That's why you do it.
Exactly. That's
right?
why you're doing it. That's the only reason why I'll have SpaceX out there. So I guess you can maybe do SpaceX, Blue Origin, Rocket One, any of the space companies. Yeah, I'd want to run that for a short time.
SpaceX rocket into space and play with your old MacBook up there.
There you go. Exactly. Yeah. That'll be it. Yeah.
You're going to the World Cup this summer.
Yeah, very excited. Yeah, Ghana's in the World Cup. Yep.
Shout out to Asamoah Gyan.
Yep, Asamoah Gyan. Unfortunately, obviously, he's retired now, but like Antoine Semenyo is going to be on the team. Pretty excited about that. Yeah, you brothers. I don't think we're getting out of the group stages, but it will be fun to see a game.
What's your prediction for the group stage matches?
I think England and Croatia make it out of the group stage. I think maybe we end up third in the group. Overall for the World Cup, my top 3 picks would be England number 3, going back and forth between where I place France. Actually, I'm going to say, France number 1 on that, and maybe Spain, Portugal 3. Yeah.
Okay, so when France beats Spain in the final, we've gone back and watched this, and you heard it here first. Anything else you'd like to share today?
Well, thanks so much for having me on this podcast to talk about River Health and obviously building a company here in the Twin Cities. The great thing about Minneapolis, as everyone knows everyone, it's definitely a small town masquerading as a big city. It is a big city. It's lovely over here, and I love it. So thanks for having me to share the story. And if you're interested in learning more about what we do at River Health, you can visit us at river.health. And if you want to join our team, reach out to us. If you know any hourly workers or employees who hire hourly workers, want to offer them benefits, reach out to us through our website as well.
That's great. Thank you so much for the time.
Thank you for having me.
Appreciate it.
Thanks.
Thanks so much to Keely Doyle, Gabe Noah, Mike Novak, Connor O'Neill, and Ali Alt for all your work behind the scenes. We will see you next time.